Our Indigenous brothers and sisters are in a looming struggle to survive during the coronavirus disease, or known as the COVID-19 pandemic. In the past, the IPs had been the most affected by epidemics, with higher mortality rates and lower life expectancies. IPs are placed in the most vulnerable health category during COVID-19. The IPs present malnutrition and immune suppressive health conditions, poor access to sanitation, lack of clean water, and more notably, inadequate medical services. These are the major contributing factors to their increased vulnerability to COVID-19. In the following videos, we will know what the IPs in the Philippines are doing during this pandemic.
Since online teaching is not an option in remote areas where the most of indigenous people are living due to lack of signals and internet connection, their elders serve as a partner of Department of Education in addressing the distance learning barriers. Michael Larkson said that IP elders underwent online training on indigenous people education. The learning materials development based on IP alphabet premieres to equip them with the necessary knowledge on how to guide and mentor their children on their studies.
Community-wide self-isolation is not new to indigenous people. The Igorot people of Luzon are one of the indigenous communities worldwide who practice temporary self-isolation as a way to protect its members during a crisis or after a tragedy. Sulang Putin o Igorot explains self-isolation practice are from the community to cleanse, heal, and recover spiritually and emotionally. As the world moves toward the peak of this COVID pandemic, our resolve to protect our larger communities must be strong. Traditions of community healing learned over millennia by indigenous peoples are helping and must be respected and protected.
COVID-19 extends a long history of discrimination to Mangyans or Mindoro. Over the centuries, the Mangyans, a group of 8 tribal communities on Mindoro, have suffered dispossession, displacement, and cultural degradation, which has impacted their access to health services. Their poor access to health care compared to non-indigenous populations can have grave consequences for the outcome of the fight against COVID-19. The lockdown imposed by the government in March also highlighted the discrimination faced by indigenous groups, including Mangyans. A report said the Mangyan groups were overlooked in the delivery of relief supplies by the government. In Mindoro, the Mangyans are complaining that the dominant populations get 4 kilos of rice per family, while the Mangyan get 2.
Life of Mangyans during and after the pandemic. Ann Norgan, Chair of the United Nations Permanent Forum on Indigenous Issues, called on the international community in April to ensure indigenous rights are respected and adequate resources are allocated to the indigenous communities throughout the COVID-19 crisis. For the Mangyans of Mindoro, what awaits at the end of the pandemic and the anticipated reopening of Mindoro to tourists is a literal illusion. The government has set up artificial villages in which some Mangyans have agreed to live. These Potemkin villages will serve as a sort of cultural showcase for tourists who will pay to see indigenous weaving, pottery, and musical traditions.
According to the NCIP, the country's sole government agency responsible for indigenous people's concern, Mindanao is home to 61% of the country's indigenous people. These indigenous people are particularly vulnerable to the spread of COVID-19 due to a lack of appropriate medication as well as health and other social services. Coronavirus had placed indigenous families and their children all at risk. Students from Mindanao's indigenous communities who moved to Manila to avoid armed conflict that forced their schools to close down now face a new threat: the threat of coronavirus pandemic's lockdown.
A novel in Mindanao during the pandemic. Although many people look to science to help them understand disasters like the COVID-19 pandemic, the indigenous peoples of Mindanao look to wisdom of ancient traditions to help them make sense of their surroundings.
The IPs believe that the man's violation of nature, as well as his inability to take care of land, water, plants, and animals are the blame for the pandemic. Humans failed to maintain a good relationship with the nature spirit guides, which are the equalitas by magbabaya. Magbabaya means creator, to take care of all creations, Amanubo said. The IPC, the scared, balance, and chaos, and are seeking to remedy.
To restore harmony, they employ rituals to seek mercy or make positive resolution from the magbabaya. But when the IPs are asked if they receive medical support from the government in this time of crisis, a report said that they only have PhilHealth coverage, which may be not enough.
The ritual that asks for protection from the Creator. In March, the IPs performed several rituals to seek the protection of the spirits or ask forgiveness from them. According to Mindanao News, the Panagpeng ritual, which invokes protection against deadly diseases, was conducted on sacred grounds in Cagayan de Oro City last March 20. To this ritual, our bylands and elders ask magbabayan to the guardians of the four corners of the world to stop the spread of the deadly disease, COVID-19.
The COVID-19 pandemic poses a grave health threat to indigenous people. They already experience discrimination, poor access to healthcare, lack of access to essential sanitation and other services. Yet, indigenous people are seeking their own solution to this pandemic. They are taking actions and using traditional knowledge and practices in their own way. Even if there is a pandemic, this is not a hindrance for them to maintain and protect their rights. Our advocacy is to give them better health care, more information dissemination, and no discrimination.